Hi, I'm Jocelyn Lagaki, and I'm a D2 here at MOSDOH, and this is...
My name is Maddie Williams. I'm also a D2 here at MOSDOH, and we are both student ambassadors here to interview our January Faculty of the Month, Dr. Richard Vargo.
Thank you. It's a pleasure to be here. As Maddie said, my name is Dr. Richard J. Vargo, and I am the Director of Oral Maxillofacial Pathology here at ATSU-MOSDOH.
So I guess we'll go ahead and jump right into our questions that we have for you. Our first one is, what first interested you in dentistry in the first place, in teaching?
Sure. So as I mentioned, I'm the oral maxillofacial pathologist here at ATSU-MOSDOH, and I'm based in St. Louis. So when I was in undergrad, I was interested in a career in medicine, specifically. Thankfully, my dad, as a hospital administrator, gave me access to shadow numerous medical specialties, ranging from family medicine to neurosurgery and pathology, infectious diseases. The list was pretty extensive. And of those specialties, I really liked pathology. So for the first 2+ years of my undergraduate training at the University of Virginia, I was pre-med, wanting to be a pathologist. While at Virginia, I volunteered in the hospital through a program called Madison House, which allowed undergraduates to work in the hospital, gain a little bit of experience, but it wasn't meant to be a shadowing program. And so through that program, I worked my first year on Wednesday nights from 10 p.m. to 1 a.m. in the emergency department. And then my second year, I worked in the acute pediatrics department. Both of those experiences were not that pleasant, to be perfectly frank. The residents, the nurses were pretty grumpy, and they seemed to be overwhelmed. It wasn't really, medicine was kind of leaving a sour taste in my mouth. And then for my third year of undergraduate, I was looking to what I wanted to select for my volunteer opportunity. And I was between the GI surgery department, or there was the dental clinic, a general practice residency program at the University of Virginia. And that seemed interesting because I never really gave dentistry a thought. But also, they offered and encouraged shadowing. They were the one volunteer opportunity that encouraged shadowing. And so I thought, why not? I'll give this a chance. And through that, shadowing the GPR, like the really nice attending dentists, the very happy and residents with a nice work-life balance, they were very enthusiastic about dentistry. And frankly, I just really liked watching extractions, molar root canals, dealing with the patients. So dentistry sort of took off from there. And naturally, I still had my interest in pathology. So when I was kind of researching dentistry and dental schools after I graduated from undergrad, early, and worked as a substitute teacher, which I'll get into in a second, I said, oh, there's a specialty, oral pathology. That seems like a great fit. And as I mentioned, I graduated early and was a substitute teacher in Pittsburgh Public Schools, and kind of developed a love for teaching through that role. And so I thought, well, doing more research, kind of asking questions. Oral pathologist is more of an academic job anyways, so it also just sort of fit that I wanted to do oral pathology. Of course, going into dental school, when during our orientation week, the ADA representatives asking people, we're introducing the 9 dental specialties at the time in 2011, and asking students who want to do what, who want to do ortho, a lot of hands raised, oral surgery, a lot of hands went up, etc. Came to oral pathology, and my hand shot up, and people were kind of stunned by that. But I was the weird one, I guess, that wanted to do oral pathology from the outset of my dental training career.
Well, we're definitely glad you're here. You keep things interesting for us.
You definitely do. I did not know you were a substitute teacher.
No.
That's pretty cool.
Yeah, it was kind of an interesting gig. I worked at a swimming pool during the summer, starting when I was 16 up until 22 when I went to dental school. And my boss there, well, at the pool, I was a janitor and the front desk worker, my boss, he was a teacher in Pittsburgh Public Schools, during the year. So the summer pool management job was a great gig for him. And so he was like, well, you're graduating early. Why don't you come work for Pittsburgh Public Schools? They're crying for subs. Because naturally, if you're a substitute teacher, you probably want to work in more of a easier district to manage as students, to be honest. And also, if for people who graduated from undergraduate universities with degrees in teaching that maybe didn't get a job, because the teaching market is pretty tough in Pennsylvania, where I'm from, they would be subs, but they would try to be subbed in districts that they hope to then get a job in. So I would say of the districts that were available to them to sub in, substitute teaching or Pittsburgh Public Schools was certainly not first or even 10th on their list of schools they wanted. But for me, it was a great job because you just would log into a website and select, I want to work this day, and look to see what jobs were available, like Taylor Alderdice High School, where Wiz Khalifa and Mac Miller are from.
Nice.
Say AP Chemistry today, or Oliver High School has algebra today, and you would just like select that job. So it was very nice, being off for that time period before starting dental school, to have a job with a lot of flexibility to work, Tuesday through Thursday, and then have 5-day weekends. So I wasn't, and also not working nights, because if I would have worked, anywhere else, like a restaurant or something, maybe I'd be working Fridays and Saturdays or weekends, nights. It wouldn't be as fun. And this was definitely a fun job. I mean, some days are certainly tough, but overall, I think I was fairly popular with the students, because a lot of the high school teachers were like ex-military guys who were kind of looking for a job. And I was the one guy who was younger than some of the students at the age of 21 and looked like I was like 15. So I just seemed to fit in pretty well there.
Nice. Well, I guess stemming off your teaching past and now current, what are your favorite things about MOSDOH, and especially about teaching here with the students?
Yeah, I mean, MOSDOH's really been a great job so far for me. I think coming from a dental school, I want to say more traditional dental school, but a dental school that has all these departments sort of siloed almost, like, diagnostic sciences, oral surgery, orthodontics, endodontics, periodontics, etc. Some of those faculty who were then under department chairs, who were then under vice deans, who were under deans, there's just a lot of layers to the academic puzzle. As you'll find when you come here, and Dr. Silva will always talk about puzzles. I find that it's nice in MOSDOH, being the director of oral pathology, to then teach the course, or teach, I don't use the word course because we have the integrated curriculum, teach the lecture series in the scientific practice course, while also working in the clinic directly with students, has been very nice, because as you guys saw in class, I'm able to provide real life cases from St. Louis to show that yes, we see these things, and we have such a vibrant and robust patient population with a lot of patients because of the volume of patients coming through the federally qualified health center who don't have care and haven't had care probably in a while, that I can say, all right, this is, we're seeing a lot, so many things that, some of these things in the lectures for the D2 year aren't, you're learning it, but you probably won't see it, versus you're definitely going to see this. So I think that's nice. And just really, I like about MOSDOH as well, another thing is the ability to work with students closely daily on a day-to-day basis directly, because at my past university, the oral pathologists, and to be honest, other dental specialties, they didn't really work, with students really in the clinic as much. I mean, the oral pathologist would come if there was a consult, but those are typically handled by residents. So they may not know the students' names, which is fine. I mean, it's, they're busy doing other things, committees, research, etc. And then, other departments, it was the same principle. Like, I'm sure some faculty didn't know my name, and didn't know my classmates' names. But here, I feel like I have a really great relationship with the D3s and the D4s, and we can talk about restaurants, we can talk about food, we can talk about the Kansas City Chiefs. I can make fun of them for Patrick Mahomes, etc. And we just have a really good dynamic that I think lends to them being comfortable to come to me with questions and just life questions, clinic questions, and lesion questions. So that's been a major benefit. And also, finally, I think being a smaller school, and as I mentioned, as I started off the answer to this question, we don't really have this siloed departments that a lot of schools have. So I can really just interact with Dr. Donovan in periodontics, or Dr. Haribabu in oral surgery. There really isn't any, like, a turf war, so to speak. Like there are some schools where oral surgery has to do all of this. They don't let perio do this, or perio doesn't let them do this. And they don't want path coming in. I help out in oral surgery. I'll come to Donovan with the question. So just really nice, faculty dynamics, and they don't get me whenever, and I really like that component of it.
Yeah, I feel like that's kind of MOSDOH's thing, is that we're all just such a community, and everyone has really good, communication between like faculty and staff and students, and it's just a really good place to be. And it makes everyone always just makes us feel like we're meant to be here.
Yeah, it's like
from
a
the
family.
beginning. Yeah, from the beginning, I have felt like that. So it's really nice to hear that the faculty also feels like that.
Absolutely.
Our next question for you is, how do you keep your students engaged so well whenever you have to give those lectures that are sometimes 4 hours, and it feels like we're just you're just talking to a screen, especially over Zoom, and even in person, how are you keeping people engaged?
Yeah, I mean, I think it's interesting because where I came from, to kind of go back to what I knew before MOSDOH, you may have class for the whole afternoon, the whole morning, but it switches up. Like, as a first year dental student, you had biochemistry all afternoon, and then in the spring you had anatomy all afternoon, and then you have other classes throughout. And as a third year, you have your 1 credits in the morning, 8 to 9, before a clinic. Wednesday afternoons we had class from 1 to 5. So it was a little bit, a lot of class, but they'd be different classes. So here, with the more block-like curriculum, so to speak, and getting a professor for the whole morning, I think it's been somewhat of a challenge to try to keep students engaged for that time. So I'm sure, as you guys recall from the lectures, I think it's important I like to break up the lecture slides with funny pictures, articles from The Onion, talking about food, owl pictures, personal stories. I think that students seem to like that, and I've heard from students, current students, past students, faculty, dentists in the community who I've given CE lectures to. They always seem to like that, it's broken up and they don't really know what to expect next, because I could just suddenly transition into something else just to give them a break. So it's not just 4 straight hours of talking about red lesions to the point of like absolute boredom. And I think that those little breaks throughout really help students. Hopefully, I'm hoping this. And based on what I've been told, I think that's the case. They can kind of get re-energized, focus again. They may be starting to zone out, and all of a sudden there's something funny, and we're back, and then they regain focus. So I think that it has been my model, and hopefully it is beneficial for the students. And then, as I mentioned with the earlier question, for teaching the D2 class, I think that it's very important to make it clinically relevant as well, so that students aren't like, why am I learning this? It's this lesion seen in like pemphigoid, it's seen in 1 or 6 in a million people. Like that's like winning the lottery. I'll never see that. Well, I can pull cases from St. Louis here at the dental center, or in my practice at St. Louis University Hospital, or just other things that are much more common, and show like, yeah, you're going to see florid osseous dysplasia in our older African American female population. You're going to see leukoplakias, etc., traumatic ulcers. And so that then it's like, oh, I should probably pay attention to this because, there it is from St. Louis yesterday. And I think, with you guys, I know Zoom was a little more challenging, but I tried to make some review PowerPoints of cases that we had, maybe the day before or a couple days before, to show like, wow, this is like, these are from this week. We've seen these things. So hopefully those efforts were all kind of showing that, would make the class more engaging and more interesting. And then in the D3 year, your lecture series was more just kind of giving a lot of information and then interacting with you in the breakout cases. And in the D3 year, the oral pathology component of their lecture series in the spring is all case-based, interactive. The slides don't have any words. It's just cases from the clinic that people have seen, and then we show the same kind of model of like, okay, here's a lesion, and they get the slides ahead of time without the diagnosis on them, and they can study and say, okay, like case 1, I think that's kind of like you guys got. I think it's a, Materia alba, or I think this is plasma cell gingivitis, and here's why. Here's how I would describe it, my differential, how I treat it, how I, with a biopsy or monitor, and then how I manage it with antifungals, antivirals, etc. And then after going through case 1 or case whatever the number, then I'll show cases from the clinic and try to engage the students by saying, here's a case in a 53-year-old female. This was your patient Corey, or this was your patient Rachel, and to show things like such that students can say, oh yeah, that is my patient. That's cool that he's showing this, and then the classmates can say, I look forward, maybe I'll see my case coming up. And I have those all kind of memorized and organized in Dropbox to allow to have all the photos I can think about to pull into the lectures.
Yeah, Jocelyn and I have talked about before, like it's amazing how you're able to remember specific details about cases and like remember which student had which patient, and it's like that's cool.
I even think it's funny, like when you like notice something that's not even right in your PowerPoint and you pay so close attention to detail, like it makes us like, I think, that much more aware, and like how we have to be trained to pay attention to that detail. Like that's cool.
Yeah, I think at the end of the day, as I teach the students, I kind of mentioned to you and started talk about it as well as the D3 years. It's okay if you don't know everything. Like I see a lot of lesions. Obviously, at the school as a consult and can do the consultations. I did it in the oral diagnosis clinic when it was open. Currently, it's closed for the pandemic, and it's St. Louis University Hospital that referred from dentists. It's okay to not know everything. That's the whole point of specialties. You can't take out a third molar that's partial bone impacted. That's what a neurosurgeon's for. Or a molar with calcified canals. That's what an endodontist is for. But, I need or want for you guys to know geographic tongue and have a good idea what you're sending to the specialist and how to describe it. So you can say, patient's got a 1 by 0.5 centimeter sessile pink nodule of the buccal mucosa. I think it's a fibroma, please excise. And then specialists will be like, okay, this person's smart. And then they'll, really try to get your practice, get referrals from you. Because not to be honest, this is sort of under the table, but I've seen specialists, not at the school, but just in practice, that can think, man, that dentist is kind of silly, or I'm an idiot sending all these things that don't need to be sent for whatever reason. And then you develop sort of a low reputation. And I want for you guys to have a strong reputation as MOSDOH alumni, and also, not to miss things, because if you don't do the same thorough exam every time, and you get tunnel vision focused on the crown that's going to make you money, or the root canal, patients develop pathology, so you have to know to look, even if it's a quick 1-minute glance around the mouth, under the tongue, sides of the tongue, just palpating things. That's how you save lives, by not missing lesions that are potentially malignant or pre-malignant.
Mm-hmm. Yeah, definitely. And I think that your teaching methods are very effective, because we just got done studying for a test that we had yesterday, and a lot of the material was, we saw it and we were like, oh, we already learned this from Dr. Vargo. It's going to be much easier now to study for this, because we basically already know all the information.
Yeah.
And it was like, it's really stuck with us. So thank you for that.
Big time.
I can't wait to use that knowledge in St. Louis. I'm ready to get there. I actually did have a question about, you said that you teach CE courses. Is that like a normal thing with most of professors to do, or just like any dentist, I guess, to do, or is that just kind of like a you thing?
No, I think it's important for dentists to, well, first off, dentists, when you're out in the community working, you're going to go to CE courses. There's study
Yeah.
clubs, around St. Louis and in any city, really. There's going to be dental study clubs that dentists will join to get CE. They'll bring in lecturers to talk about certain topics. And so as a specialist, that's one way to, one, educate dentists. Obviously, I think, I like teaching. So by giving the C courses, getting to interact with patients, dentists to show what I can do, but also specialists will do it as a source of referrals. So like, wow, this guy is like, knows what he's talking about. Like, man, I should send my patients there. So a lot of oral surgery groups, especially in St. Louis, they'll have study club, they'll kind of lead study clubs and CE courses so that dentists will go to those and be like, man, this guy is a great oral surgeon. I'm going to send my patients there for their wisdom teeth removal or implants, whatever. And so, the faculty at MOSDOH, some do give CEs to the community. It's not really required, of course. We don't, and we just recently, within, I think it was 2020, became established as a CE site through the ADA CERP, which accredits, CE organizations. So you have to go through a somewhat rigorous process to show that you're qualified to give talks that dentists can get continuing education from. So Miss Patty Pugh here in St. Louis, was in charge of that. And now our site's registered with the ADA and the Academy of General Dentistry to give these CE credits. So we can, they're working right now to then plan lecture series through MOSDOH. So then dentists in St. Louis can apply for, I want to go to the MOSDOH lecture by Dr. Vidge on, aesthetic dentistry in the anterior maxilla, or I want to go to a CE on digital dentures by Dr. Kruger, or white lesions by Dr. Vargo, et cetera. And then that will be ideal because then we'll gain, more prominence locally and at a statewide level, because of course, hopefully dentists can zoom in or come from Southwest Missouri or Southeast Missouri or Northeast Missouri to come down to watch CEs by the specialists here at the school, or just general dentists who are giving talks as well.
Gotcha. Well, that's really neat. I didn't know that we did that.
Yeah, that is very cool. The more you know.
Yeah.
Well, before we wrap up, do you have any like last minute words of wisdom, any fun pancake donut places you've been checking out lately?
Yeah, so, as you guys know, I'm a big foodie. I love dessert. I love pancakes and cookies. Actually, this week at Crumble Cookies here in St. Louis, it's a national chain. I guess it's from Utah. A lot of the students love it. And this week they're offering Biscoff lava cookies, which are fantastic. And so I'll probably be going there tonight, to be honest, because they change the menu on a weekly basis. So this is the week that has good offerings. St. Louis does have a great food scene. Give it a chance when you come down, as does Kirksville. So it was a little disappointing. One, because I couldn't teach you guys in person. So you get to experience like the laughs and the cases in person, but more so, well, not more so, but as well as not getting to go to Mikasa and other Kirksville gems that, I have reviewed on Yelp and gotten the Yelp featured photos for. So, food here is good. And really, look forward to you guys coming down and, T-minus 5 months, I guess, right? June 2021, it's coming. And I think you'll be here probably, right, for rotating through MOSDOH on Fridays, will you not? Like the clinic, did you, like you guys came down and
Oh yeah, we're doing that again this semester.
Yeah, through like whatever the patient center care course or whatever with Dr. Vidge, you'll come down and Dr. Allenson, which is really cool. So take advantage of that opportunity to work with a student, a D3, a D4, to see the procedure, to kind of see how you interact with the patients, be it a patient that requires a translator or just a patient that's more medically complex. You're going to see a lot here, very interesting and diverse population of patients. You're going to get a lot of work with, with extractions, operative, SRPs, great opportunities to do work in endo, implant with Dr. Kareem, and hopefully we'll get to work together on consultations and biopsies and management of the lesions and the conditions we see, because we do see, lichen planus. We just had a nice case of lichen planus this week. So, it happens, it's there. They say it's rare, but, in kind of, I don't want to say it, we're not really a tertiary referral center because people don't refer specifically to the school, but we are a large center for the St. Louis region who have Medicaid and lower income patients, and a lot of them have these oral pathologies and other diverse dental issues that you'll get to manage when you come down here. So take advantage of it for sure.
Sweet.
Can't
Definitely
wait.
doing that. Yeah. All right. Well, if you don't have anything else for us, I think those are all the questions that we have for you. So thanks so much for joining us today, and you rock. So,
Yes,
Thank
thank
you
you for your time, Dr.
very much. I
Vargo.
appreciate that. It was very fun. Thank you guys.
all right. Have a good weekend.
Too. Bye.
Bye.
See ya.